Welcome back. Welcome back, guys. Okay, so today we're going to be looking at, we're going to be looking at some major diseases that are actually associated with high sugar intake or high sugar consumption. That's what we're going to be looking at today. So I'm not going to do much explanation on them. I'm just going to do very brief explanation and list the various ones that actually were associated with high sugar consumption. We have the first category on the list are metabolic and endocrine diseases. You see, these are these are the most directly linked conditions. An example of metabolic and endocrine diseases include type 2 diabetes. You see, chronic or high sugar level. That's number two. Then number three is obesity. You see, sugary foods and drinks are calorie dense but not satiating, leading to overconsumption. And this is fructose in particular is linked to what? To visceral fat. And when we say not satiating, uh we're talking about calories that are unsaturated. You understand? They are unsaturated. So anything that is unsaturated is actually uh a no-no for the human body, especially when you consume it in high quantity continually is actually a no-no for the human body. Then number four, non-alcoholic fatty liver disease. This excessive consumption of excessive fructose is metabolized almost exclusively by the liver, which is which is converted into fat, leading to fatty liver infiltration and inflammation and even potential cirrhosis. So this is fructose that we're not talking about two consecutive times now. So let's move to the second category of diseases. We've talked about metabolic and endocrine diseases. So now move to cardiovascular diseases. Number one is hypertension. You understand? Hypertension. Oh, we'll talk about cardiovascular diseases. We're talking about diseases that are associated with the heart and the blood vessels. So the heart and the blood vessels is what specifically makes up cardiovascular diseases. So the first on the list is hypertension, popularly known as high blood pressure. High sugar intake can lead to high insulin levels, which may activate the sympathetic nervous system and increase sodium retention in the blood. You understand? So that's how the body actually what hypertension actually starts forming. Then the second on that list on cardiovascular disease is what called atherosclerosis and coronary heart diseases. You see, sugar drives inflammation. I would say inflammation, talking about swelling, and this raises triglycerides and lowers HDL, which is HDL is a kind of a good cholesterol that the human body actually needs. And with lowering of the HDL, this contributes to the formation of small and dense LDL particles that are more likely to clog the blood arteries. You understand? So that's another type of diseases that is associated with uh, high sugar consumption or high sugar intake. Then the third on this list on cardiovascular diseases are ischemic stroke. So the same inflammatory and atherosclerotic process that affect the heart also includes blocking that arteries that connects to the brain. Now, anytime you hear about stroke, what actually causes stroke is the blockage of the blood vessels that takes blood to the brain. Anytime there is a blockage of any blood vessels that moves blood to the brain and it blocks it more than a particular duration of time, it can actually lead to any kind of stroke. You understand? So it can be minor, partial, or full stroke. Then the third category of sickness that is associated with high sugar consumption is dental diseases. I think the most popular one is popularly known as dental caries or tooth decay. Oral bacteria, they actually what? Oral bacteria ferment dietary sugars to produce acid that dematerialize tooth enamel. You understand? Okay, so what this actually means is that there are bacteria in your mouth. You understand? So when they ferment this sugar, when they ferment this sugar, they produce acid as a end product of fermenting those sugar. And those acid that they produce, they are being released into the enamel of your tooth. And this enamel now gets destroyed because an acid, remember that acids are corrosive. So they wears out away the enamel, which is the crown of your tooth that protects your tooth against any kind of this. But when this acid continually wears away a surrounding of this your tooth, it now exposes your tooth to quite kind of negative condition that makes when you eat you are feeling very sharp sensitivity on that your particular tooth, and the teeth tooth rather actually starts degenerating from that particular time or that particular condition. Then the fourth category of disease associated with high uh, sugar consumption is neurological and psychiatric condition. Now, also neurological and psychiatric condition, I was talking about diseases that are associated with the nervous system or the brain and the spinal cord, how nerves actually communicates within the human body. Now, the first on that particular list is cognitive decline or dementia, including Alzheimer's diseases. Now, some research is about Alzheimer's, uh, type 3 diabetes are linked between insulin resistance, brain, and neurodegeneration. So this is what research has actually what proven that Alzheimer's is linked. Alzheimer's or type 3 diabetes is linked with high insulin resistance in the brain and neurodegeneration. The neuro, we're talking about degeneration of the nervous system or degeneration of the nerves. You understand? So remember that insulin resistance can happen in any part of the brain, but when it in any part of the body rather, but when it's now happening in the brain, it's not something that it's a very serious or critical condition rather. So and it shouldn't be taken for granted. Then the next category of problems or diseases associated with high sugar consumption is depression and anxiety. Now, because of the fact that high sugar diets are associated with increased risk of mood disorders, there's like they are likely uh these are likely being produced to blood sugar swings, inflammation, and disruption of the gut-brain axis. You understand? So this is how depression and anxiety actually what happens or how they take place. Then the last on this particular category is addiction like eating behaviors. You see, sugar triggers dopamine release in the brain's reward center, which can lead to cravings, tolerance, and loss of control. You see, if you're somebody who consume high sugar, discover that after something, whether you are hungry or not, whether you are consumption is, you know,